a medical intern from King Abdul-Aziz University, Jeddah, Saudi Arabia. Today we'll talk about the titanium versus silicone myringotomy ventilation tubes. It's a cross-sectional study of outcome and complications. I have nothing to disclose. Alice media, the inflammation of the middle ear, is one of the most common diagnoses made in children. In most cases of otitis media, it will resolve spontaneously within 3 months. However, around 25% of the cases will develop chronic otitis media with effusion. And a systematic review published in 2011 showed that many different types of tubes are used, and their patency, complications, and duration may differ. Another systematic review aimed to study the effectiveness of ventilation tube treatment in children with secretory otitis media mentioned that there is a strong scientific evidence that ventilation tube treatment of secretory otitis media improves hearing for at least 9 months, and the quality of life is improved too. A retrospective study titled Long-Term Complications of Ventilation Tube Insertion in Children with otitis media with effusion concluded that despite the high complications rate, ventilation tubes insertion still remains the treatment of choice in children with otitis media with effusion. And regarding the factors that may affect the prognosis, a review study was done in Italy documented that factors that influence the prognosis are the age of the patient at the time of initial placement of the tube, concomitant adenidectomy, the type of the tube that used, and the duration of maintenance in the ventilation tube, and also regular follow-up. The objective of our study is to compare the results of implanting a titanium tympanostomy tube in children and compared with the more commonly used silicone-based tube in an age-matched case-control retrospective study. We aim to study the rate of early and late post-operative complications, such as extrusion rate, rate of infection, otorrhea, tube obstruction, and residual perforation. So it's a retrospective case control study. Records of patients undergoing myringotomy with ventilation tubes insertion for recurrent otitis media or serous otitis media lasting for over 90 days from January 2018 to December 2020 were reviewed. A group of 34 children treated with different types of ventilating tubes. Titanium ventilating tubes with size of 1 millimeter and silicone tubes with size of 1.14 millimeters. Children aged older than 6 months who were diagnosed with unilateral or bilateral otitis media with effusion for 3 months or longer without resolution as evidenced by persistent type B tympanogram with documented hearing loss were included in our study. Excluded children younger than 6 months or older than 12 years and children diagnosed with retraction type ear disease like atelectasis or adhesive otitis media. Records showed follow-up first at 2 weeks, then at 3 months intervals for a duration of 12 months or until the tubes were extruded. Since the patients follow up at 3 months intervals, the exact time at which the tubes were extruded was difficult to pinpoint. Therefore, the extrusion time was set as the time of the visit for statistical and research purposes. Of the patients enrolled in the study, 3 had missing aspects of data not recording during the follow-up visit. So, a phone conducted interview was taken to complete the missing data. Moving to the demographics part of the results, the study was completed with 34 patients who were underwent tympanostomy ventilation tube. Males and females involved were equal. In 17 patients, we used silicone type of ventilation tubes, and we also used titanium type for the others. The mean age of all patients involved in the study was 6.12 years, with their age range from 2 years to 11 years. There were insignificant differences in the age of patients involved in silicon and titanium subgroups. In respect with the perioperative, nothing of the complications were recognized, like for example, falling of the ventilation tube in the middle ear, insufficient myringotomy, or bleeding. During the surgery, there were no reports of ossicular chain destruction or extended inflammatory illnesses, so we didn't have any issues with general anesthesia. No child developed a perioperative incidence in our study, which is consistent with earlier data. We used the age of 12 to 18 months as a cutoff point to determine whether the problem was an early or late surgical consequence. Early postoperative complications were blockage of the tube and was seen in 3 of our patients, recurrent ear infection, and it was documented in 5.9% of our data. On some patients presented with transient otorrhea, which means occasional middle ear secretion leak through the tubes, for more than 3 months after surgical procedure, and this was documented in 14.7% of our patients. While all of which were insignificant, however, early extrusion of the tube is the most frequent early complication of ventilation tube insertion in our study. It was observed particularly higher among titanium subgroup. Ventilation tubes were extruded spontaneously in all silicon subgroup and in 14 of the titanium subgroup, and the other 3 patients of the titanium subgroup, the tubes were intentionally removed after 24 months. 9 patients had late tube extrusion, which was considerably higher in silicon versus titanium subgroups, with percentage of 29.4% against 23.5%. The titanium subgroup had a longer tube extrusion time than the silicon subgroup, with a mean of 15.31 and range of 6 to 36 months, and it was statistically significant. Premature or early ventilation tube extrusion occurs when the ventilation tube extruded spontaneously before 6 months after insertion. Tympanosclerosis, perforation, retraction of the tympanic membrane, and cholesteatoma were all included as a functional and permanent structural sequelae following the tube extraction. Retraction of the tympanic membrane is the most common late post-operative complication, and it was recognized in 8.8% of our data. Moving to the discussion, a prospective trial was designed to compare the function and the extrusion rate of titanium grommets with the standard design of Teflon grommets. Patients were assessed at 4, 8, 12, and then 16 months post-operatively by history of middle ear infection, otoscopy, and pure tone audiometry. This study observed that at 8 months, there are significantly more titanium than the standard design of grommets, but there is no significant difference at 12 or 16 months. And inconsistent with our results, they didn't find any evidence from this trial to favor changing from our normal practice of using the standard design of grommets. Interestingly, otorrhea considered as the most common consequence of ventilation tubes, occurring in 3% to 50% of patients. On the other hand, a review of literature study published in 2020 enrolled 68 children, evaluated preoperatively, early and late postoperative events with clinical examination, audiometrics, and tympanometric tests, shows a lower incidence of complications than the literature, particularly regarding otorrhea. A prospective controlled study was undertaken in which, in 100 children, a titanium ventilation tube was inserted in one ear and a silicone tube was inserted in the contralateral ear as a control. The tubes were evaluated in respect to length of time of intubation, episodes of otorrhea, and early occlusion. And after a long-term follow-up of these tubes, there were only little difference in the incidence of tube occlusion, early extrusion, or infection with otorrhea. And they mentioned that also, since the titanium tubes is more than twice as expensive and has no proven advantages over the silicone tube of similar design, they have no reason to recommend the use of titanium tube over the less costly standard silicone ventilation tubes. In conclusion, the use of ventilation tubes for treatment of patients with otitis media with effusion who meets the criteria for insertion is like any other surgical intervention associated with the risk of complications, even though factors affecting the rate of complications are multiple and variable.
Thank
Based on
you,
our
Sarah.
population findings, the rate of complications doesn't appear to differ significantly with the use of different materials of ventilation tube, including both of the early and late postoperative complications. However, for more accurate representation and to be able to generalize the results on the population, a further research and study included a larger population is needed. This is the end.